There are two types of diabetes, which consists of type 1 and type 2. It is important to understand the distinction between the two and how both are treated. Type 1 diabetes is commonly found in children and/or adolescents, but may also occur in adults. With type 1 diabetes, there is almost always a complete deficiency of insulin. As a result, the most common treatment is insulin injections, a lifestyle that consists of both diet and exercise and regular monitoring of blood glucose levels with the use of blood testing monitors. Patients who have been diagnosed with type 1 diabetes can continue to enjoy a normal life providing they continue with their treatment and take special care to follow their doctor's instructions and/or recommendation. With type 2 diabetes, an individual's insulin level is usually either normal or sometimes even elevated, but is not deficient. This form of diabetes is believed to be more complicated than type 1, but ironically is thought to be easier to treat. Because insulin is still being produced inside the body, type 2 diabetes often goes undetected for years. Symptoms are milder and may even be sporadic, which often reduces the level of concern. The main problem with type 2 diabetes going unnoticed is the potential for serious complications, including renal failure and coronary artery disease. The initial treatment phase of type 2 diabetes will likely include a lifestyle adjustment to feature increased physical activity and a diet that is geared toward weight loss. The next step, if necessary, will be medication and possibly insulin therapy if needed. Both types of diabetes require that the patient maintain normal blood glucose levels in an effort to reduce the possibility of organ damage, including eyesight, kidney, blood circulation, etc. In order for this to occur, patients must carefully monitor their food intake and make sure to participate in regular exercise, all the while continuing to monitor their blood glucose level. As of 2006, there is no known cure for diabetes. A chronic disease that affects many, diabetes is best treated through patient education, nutrition, self-awareness and long-term care. In addition, patients are often urged to be aware of other symptoms that may indicate complications arising from diabetes. The contents of this article are to be used for informational purposes only. It should not be used in conjunction with or in place of professional medical advice relating to diabetes. This article must not be used as a basis for diagnosing or treating diabetes, but rather an informational source designed to explain the difference between the two types. For further information, a diagnosis or recommended treatment method for diabetes, individuals should consult a licensed physician. If you want more information about my channel, please visit superblackeyeSort.www. UCLNKZWQ KEC 1P 4 LOECM 9 MUL Q.